Hello, everyone. Welcome to today's session, Future Ready Cybersecurity and IT Strategy for Healthcare, Empowering Compliance, Resilience, and Innovation. We're so excited that you could take some time out of your busy day to be with us on today's session. We have just a couple things to go over, and then we're going to dive right into today's presentation. So I have just a few logistics. Today's session is being recorded, and we're going to send out the recording tomorrow afternoon. So whether you're hearing this live or you're seeing this on recording, that will be in your email. And then this webinar will also be available on our YouTube channel. It's another great resource. There's tons of content there, past webinars, how-to content, anything you can imagine. So great thing to check out. Everyone has been placed on mute to keep background noise to a minimum, but that does not mean we do not want to hear from you. You can always put, questions in the chat, in the Q&A area. We will do a question and answer session at the end of the presentation. So put those questions in as you think of them, whether that be in the chat or the Q&A. I'll find it and I'll make sure that we get those asked during that Q&A at the end. So that is all. We're thrilled that you've taken some time to be with us. And SWK is always here to help you fulfill your vision of a smarter and easier way to run your business by providing you with tools, support, software, and industry knowledge whenever you need it. So that's enough for me. I'm going to hand it over to today's presenter, Dave Monroe, and let him tell you a little bit about himself. Dave, welcome.
Hey, thanks, Courtney. Hey, everybody, how you doing? My name is Dave Monroe. I'm a technical account manager here at SWK. Excuse me. In my role as a technical account manager, my goal is to guide my clients through complex infrastructure, cybersecurity, licensing, and line of business application challenges. Prior to SWK, I served in help desk, field technician, and NOC engineer roles. Specifically, as it relates to the medical industry, I worked for a time in a local hospital's network operations center, acting as a level 2 escalation point. And that experience has proven invaluable as I've helped my clients navigate the unique and complex challenges. Of course, my goal is to maintain open communication with all of my clients, sustaining a relationship that is built, on trust, transparency, and ultimately results. Today, we're going to take a look at how healthcare organizations like yours can shift from reactive IT security to a forward-thinking model with integrated strategy focused not just on protection, but also on resilience, compliance, and operational efficiency. I'll guide you through the challenges and opportunities in today's healthcare IT landscape. And this presentation is organized to help you understand not only the why behind these shifts, but more importantly, the how to get started. Quick overview on SWK Technologies. We are a nationally recognized MSP and solutions provider in North America and have nationwide coverage, leveraging over 170 employees to delight our customers and enable success. And now, next slide, I will get into the presentation. Beyond protection and detection, right? So let's start with the reality that most healthcare organizations are facing. There are too many tools and not enough integration. From endpoint protection to firewalls to SIM platforms, these tools often operate in silos. This overloads IT teams with alerts, most of which are false positives, causing alert fatigue and missed real threats. Evaluate your current cybersecurity stack for overlap, gaps, and alert fatigue. Consider consolidating or integrating tools for centralized visibility. Next, visibility across your environment is becoming more difficult, especially with the rise of remote work and cloud-hosted systems. Many organizations simply can't see what's happening across every device or cloud instance, which leaves patient data vulnerable and compliance at risk. And finally, most organizations are still in a reactive posture. Without a unified system that detects threats in real time and automates a response, breaches are usually found only after damage has been done, when it's too late to prevent data loss or system downtime. Next, talent gap reality, right? So one of the biggest challenges facing healthcare IT today, is the growing shortage of skilled cybersecurity professionals. The demand is simply outpacing supply. And when you add the need for specialized healthcare knowledge, like HIPAA compliance or EHR system security, it becomes even harder to find the right people. Geography and budget also add to that problem. Excuse me. Rural hospitals or smaller clinics can't offer the same salaries or flexible environments that tech companies in urban areas or urban hubs can. So even if there are candidates out there, they may not be accessible to you. And even when you manage to build a team, burnout is a major issue. Cybersecurity staff are often under constant pressure, and the high alert volume and long hours lead to frequent turnover. That creates a revolving door where you're constantly onboarding, retraining, and losing institutional knowledge, ultimately increasing your exposure. Assess your internal IT security capabilities and identify areas where outside support is needed. Use a maturity model or a readiness checklist to pinpoint where staffing or skills are insufficient for today's security demands. Next slide, the evolving threat landscape. So healthcare is now the #1 target for cybercriminals. Ransomware has evolved. It's not just about locking up your data anymore. It's about bringing down entire clinical enterprises, clinical operations. Imagine your EHR imaging system being held hostage. At that point, it's not just an IT issue. At that point, it becomes a patient safety issue as well. Phishing remains a top entry point. These attacks are more sophisticated than ever, often imitating internal messages or vendors. And when someone clicks, the attacker begins quietly moving through your network. And now with the use of different AI tools, phishing attempts really do mimic not only a personalized kind of cadence or personalized wording of your employees, but also can do the same thing for your vendors too, right? So they're really, really complex and coordinated attacks. Make sure to run simulated phishing tests and review results with staff. Regularly test staff awareness and implement targeted training based on real-world email attack simulations. And finally, many healthcare systems are still built on legacy infrastructure, and unsupported servers, siloed databases, and outdated applications. These are absolute magnets for attackers. You can't defend what you can't monitor, right? And these blind spots increase your vulnerability exponentially. Infrastructure modernization. Very, very important, especially in the healthcare space. To protect and scale effectively, we need to modernize infrastructure. Virtual desktop infrastructure, or VDI for short, allows staff to access your system securely from any location while keeping patient data locked down at the source, right? So it simplifies access control, strengthening security posture as well. And you want to start with evaluating one legacy system, right? You don't want to, if you're looking at the big picture, maybe just cherry pick one, at least to start, and evaluate that legacy system or server for cloud or VDI migration, excuse me. Start with a high maintenance or underperforming system, right? And assess the cost, security, and scalability benefits of modernization. Moving to hosted servers removes the headaches of aging hardware and manual updates. Your team can focus on outcomes and not uptime. A huge benefit there from that migration. And cloud solutions bring security and scalability together. They come with encryption, advanced logging capabilities, and compliance features built in, making it easier to check all the regulatory boxes while also remaining agile. Excuse me. HIPAA compliance simplified. Next slide. So HIPAA compliance doesn't have to be overwhelming. With the right systems and tools in place, you can automate key requirements like access logs, configuration tracking, and audit reporting, making compliance not just easier, but more consistent. Risk assessments are another area that can be simplified. Instead of complex spreadsheets, you can use different AI or automated tools systems that map your environment against HIPAA benchmarks and generate prioritized actions. A very important step here is to make sure you schedule a HIPAA risk assessment and test, your HIPAA compliance. Make sure you do that, as soon as possible if you haven't done so already. And also, while doing that and evaluating, your different tool sets, make sure to choose a tool set that streamlines risk documentation, access logging, audit readiness. This all simplifies compliance tracking. SWK can definitely lend, a helping hand and assist, here as well. And finally, aligning with the broader frameworks like NIST or SIS helps you meet HIPAA's vague requirements more confidently. These frameworks are practical and proven. They give you a blueprint to follow and demonstrate due diligence to auditors. Business continuity readiness. Excuse me, dry throat today. We can't just focus on preventing breaches, right? We have to be ready to recover from them. That's where disaster recovery as a service comes in. It lets you quickly bring systems back online from clean, offsite backups in hours, not days. Offsite backups are your last line of defense. They need to be tamper-proof and easily restorable so that ransomware doesn't trap your data. And your team needs a real tested incident response plan. Tabletop exercises can reveal gaps in your plan before a crisis hits, ensuring your response is fast and coordinated. Simulate a real world outage or ransomware event to identify gaps in recovery time, communication, or documentation. A well-established and tested incident response plan will fill in those gaps. Pulling it all together. So security can't be piecemeal. You need a layered approach, right? So if this isn't your first SWK webinar, specifically with myself, I often when I talk about cybersecurity, I often talk about in needing a layered approach, right? And the same proves true here. You need a layered approach that combines prevention, detection, and response, ensuring that your tools are working together and not in isolation. But tools alone aren't enough. Your people will need training and your processes need to be clear and repeatable because that's how you act decisively under pressure. Excuse me. And everything needs to be tailored to healthcare. Uptime, compliance, mobility, and patient safety all require industry-specific strategies that generic IT providers just can't offer. Identify where you fall within the 5 core areas. So the 5 core areas are identify, protect, detect, respond, and recover. And then once you identify where you fall short in those areas, make sure you prioritize improvements and to get those done. Next, I have 2 different slides. Both are the SWK advantage, right? So the first part, I have a 2-parter here. SWK brings together everything we've talked about today: 24 SOC monitoring, HIPAA compliance, expertise, and proven solutions tailored to healthcare organizations. Our SOC, or Security Operations Center, operates around the clock, staffed with experts who know how to interpret healthcare-specific risks and act quickly. And our IT staff are HIPAA trained as well, so every solution we implement is designed with compliance in mind. We deploy these solutions across a wide range of clinical environments. We understand how to scale them to meet your unique needs as well. SWK Advantage Part 2. So here I decided to take a look at the top 5 healthcare IT problems and then how SWK can assist in solving them. So taking a look at the 5 key challenges that healthcare organizations such as you face and how our managed services team can address each one. First, I want to talk about cybersecurity threats. So we provide 24/7 monitoring through our SOC. We protect endpoints, filter email threats, and train your staff to recognize phishing attempts. That means fewer breaches and faster response times. Second, HIPAA compliance. We simplify it with performing risk assessments, policy templates, and continuous compliance monitoring. Third, the IT talent gap. Whether you need a full support or just help with some key projects, we bring in certified experts to support or supplement your internal IT team, right? So that gives you flexible enterprise-grade capabilities without the hiring cost. Fourth, aging infrastructure. We help migrate outdated systems to the cloud or your chosen hosted environment, implement virtual desktops, and automate system maintenance, all to reduce downtime and improve reliability. And finally, downtime and disaster recovery. With offsite backups and tested business continuity plans, and also incident response plans, we make sure you can recover quickly from any outage, attack, or disaster scenario. So that wraps up our new content portion of the webinar. So I just wanted to take a few moments here to wrap things up and just call out 5 key takeaways from today's discussion. So first, cybersecurity must be integrated, not just a collection of disconnected tools. Visibility, automation, and coordination are critical to staying ahead of threats. Second, the cybersecurity talent gap makes it nearly impossible for healthcare organizations to manage this alone. Managed services and expert partnerships are the sustained path forward. Third, healthcare is now the most targeted sector for cyber attacks. Protecting your data and systems is no longer optional, it's urgent. Fourth, upgrading your infrastructure and moving it to a VDI environment, hosted system, or cloud platform not only improves security, but also reduces the day-to-day IT burden. And finally, SWK brings this all together, right? We offer scalable, compliance-ready solutions that align with healthcare needs, helping you to operate securely and confidently. Well, thank you very much for attending the webinar. As you can see here on the screen, these are a few of the services that our SWK Managed Services team that we offer here at SWK. And yeah, just take a moment, take a look, and see if something fits into a conversation you're having internally, and let a resource here at SWK know. And I'm going to kick it back over to Courtney. Oh, there we go. Sorry, a little delay there.
I am here. Thank you, Dave, for sharing all of that great information. I'm sure we have some questions. I know I have a couple. So we're going to go ahead and dive into Q&A. If you're out there in the audience and you have a burning question, put it in the chat, put it in the Q&A, wherever you want, we'll find it, and I'll have Dave answer that. So Dave, the first question I had from someone was, how would you be able to work with an existing IT staff? We have our own.
So one of the main things, or the main ways that we can do that, we can be an extension of your internal IT team, and just think of it as a separate department, a separate level, separate team, so to speak, that goes and handles your day-to-day things, your IT patching, your upgrades, your monitoring, managing your alerts, whether there's the cyber alerts, or whether they're network alerts, or on-prem infrastructure alerts. We can go through and take on those arduous tasks. The team we have here at SWK is definitely well versed in that, so we can manage it together.
Great, that is great to know. And that actually spurs a question that I'm wondering about is, what are you seeing, and maybe the team at large seeing, organizations needing the most help with?
So it's going to most help, right? So we're experiencing a lot of on-prem to cloud infrastructure migrations at this point. From an infrastructure side, from a security services side, we're really seeing an uptick in phishing training interest. So cybersecurity awareness training, we're definitely seeing an uptick there. I definitely, and the clients that I manage definitely drive that home. It accomplishes a few things. First and foremost, it enables your staff to be ready for these really sophisticated type of phishing attempts. And second, when it comes to cyber liability insurance, they also love that too. There might be benefit there, is what I'm saying. Yeah.
Yeah, got it. That makes a lot of sense. And I think we've all seen that shift from, from on-prem software and service over the past, decade, to everything seems to be in the cloud now. So I think I have one more question from the audience, and I think we're going to wrap unless there's any other final, submissions there. But where would this person said, where do I start looking for evaluating our cybersecurity? So, Dave, where would you recommend someone starts looking when they're going to evaluate their cybersecurity?
The first place I would tend to look, if we're looking or considering your infrastructure, just know where you're at in that life cycle. Infrastructure, your applications, things of that nature. I say that a lot of times organizations are using outdated hardware, outdated software, and if they're not being updated by the vendor, that creates a massive security loophole. I would also, again, to drive home the phishing training, I would also focus there in tandem. Your people are your first line of defense, and if they're not enabled to recognize, these increasingly sophisticated threats, the infrastructure at that point doesn't matter. That matters less, I should say. If they're willingly let through by somebody who hasn't had that type of training, they can wreak havoc no matter what you have. So I would definitely just make sure your employees are trained and aware as well, in tandem with updating infrastructure, maybe investing in some advanced logging services, alerts, monitoring, things like that.
Okay, yeah, that makes a lot of sense. So with that, I think we're going to wrap for the day. So thank you, Dave, for fitting so much information into such a short amount of time. If you want to, learn more, you can always reach us at info@swktech.com if you want to connect with the team, if you've got questions, if you want to dive into some of these solutions. It's a great way to reach us. We'll put you in contact with Dave, his team, the right people. You can also check out our website at swktech.com. We have a ton of resources, not only on things like hosting and infrastructure as a service and all of these great solutions that we offer, but tons of education as well. On our website, you can check out our blog. We have a lot of articles about, cybersecurity, what's happening out, on the dark web, all those kinds of things, a ton of educational information that comes, from Dave and his team and everyone here at SWK. So it's a great resource if you're looking to learn more, especially specifically for healthcare. So thank you, Dave, for sharing all that information with us today. And thank you, everyone who took a little bit of time out of their day to be with us.
Thank you.
You all have a good one.